Good morning from WKYT News. I'm Bill Bryant. We hope you're enjoying your weekend, and we welcome you to Kentucky Newsmakers. Our campaign 2016 coverage continues with today's guest. Congressman Andy Barr is seeking a third term in Washington. The Republican from Lexington is facing Democrat Nancy Jo Kemper on the November 8th ballot. Kemper was here with us a couple of weeks ago. As the incumbent, we can ask Barr not only about where he stands on issues on the horizon, but also some of what he's been working on in recent months in D.C. It is also an interesting political year with the presidential race providing drama and some tough discussions in workplaces and maybe around your kitchen table there all across our country. Certainly an exciting year. The 6th District is politically competitive. Democrats slightly outnumber Republicans, but the gap has narrowed in recent years. The region is centered on Lexington, home of the University of Kentucky, but more than half of the district lives outside Fayette County and other fast-growing places, including Richmond, Georgetown, Berea, and Nicholasville. It also includes more rural and agricultural areas and the Bluegrass Army Depot, where Nerve Agent is stored. Congressman Andy Barr in with us this morning. Thanks for coming. Appreciate it. Good to see you.
Good to see you too, Bill.
Surprised we got a minute with you out there. You're campaigning and working D.C. right now as well,
busy
right?
time, busy time.
This has been an interesting political year going on. We know that some of the issues are national in scope and some of them are quite local, and here's one that is both. Kentucky has a major problem with drug addiction. This year we've seen a spike in heroin overdoses and deaths. First responders say they are overwhelmed. Many of our counties are told you need a larger jail or you need more treatment facilities, and they say we don't have any money for that. How is much of this is a federal issue?
It's a federal issue for a variety of reasons. Number one, because it is a national problem. Addiction doesn't just affect us here in Kentucky, although we have the third highest drug overdose mortality rate in the country. And it's unfortunately growing here in Kentucky, but it affects other parts of the country as well. You see a big issue in Ohio, in New Hampshire, all across this country. Addiction is a big problem. And recently, opioid and heroin addiction, and we're seeing this fentanyl coming into play, which is a very deadly kind of drug. So it's a big problem, and it affects interstate commerce. It's a national problem because it affects workforce readiness. So it impairs our economy when our workforce is addicted. But it's really the tragic stories that I heard just traveling the district in my accessibility initiative, listening to pastors, listening to churches, the people in the faith-based community, the first responders, as you said, and then the families, the moms and the dads who have an addicted child or a brother or sister. And we knew we had to do something about this. So at the beginning of my second term, I invited the director of the Office of National Drug Control Policy, an Obama administration official, Michael Botticelli, to come to our district. We met at the Hope Center in Lexington, and we brought together experts in all aspects of the fight against drug addiction. So from the education world and prevention world to law enforcement, federal, state, and local, the DEA, the state police, Kentucky State Police, to the local sheriffs and local police departments, the judicial branch, the U.S. attorneys, the drug court folks, the Kentucky Office of Drug Control Policy, and then moving into the first responders, the emergency room, the providers, the healthcare world, and the recovery world. A lot of nonprofits, a lot of faith-based groups that are trying to help people recover from addiction, reintegrate into the workforce and into society so that they can lead productive lives.
What is the consensus of that group?
We met multiple times over the last several years. The 6th District Drug Abuse Task Force is what we called it, and we broke out the groups into different subcommittees. They all reported back to our office recommendations. We took those recommendations to Washington, and we helped amend legislation, proposed legislation that was ultimately included in federal legislation that was signed into law end of July called the Comprehensive Addiction and Recovery Act. This was a major success of the last Congress, a bipartisan, bicameral bill signed into law by President Obama that streamlines and enhances a lot of our anti-drug addiction policies in Washington. And so a couple of examples of what we're doing. More money for drug courts, so diversion. We know we can't incarcerate our way out of this problem, so for nonviolent first-time offenders, let's get folks into recovery to see if that works. We also know that we have this terrible tragedy with babies born addicted. If you talk to the nurses in central Kentucky, in our, not just the rural hospitals, but in urban hospitals as well. This addiction crisis does not discriminate between urban, rural, affluent, or low income. It affects everyone. And what we've seen is a tragic spike in the number of babies that are born addicted because of mothers who are abusing opioids. So we had a pediatrician who was part of our task force from the University of Kentucky, Dr. Henrietta Bada-Elzey. She recommended we need best practices for pediatricians, obstetricians on how to treat babies with neonatal abstinence syndrome. And so we took her recommendations back, and it was included in the final legislation for a national study on best practices. Also for our prescribers, our doctors, we form an interagency task force at the federal level to come up with best practices on prescribing so that anesthesiologists and other physicians that are treating pain can maybe prescribe non-narcotics or other kinds of pain treatment that don't involve narcotics to avoid addiction. And then on the law enforcement side, I've been an advocate for the HIDTA program, high intensity drug trafficking area program. That's more money, federal resources to help our local law enforcement. We designated Madison County because of its high intensity drug trafficking corridor, I-75, Berea, Richmond, a HIDTA county. That brings more federal resources to help our sheriff and our local police.
They've also been told, for instance, in Madison County, that the jail is woefully overcrowded, that there are not adequate facilities to do treatment, and that they've been advised by a local group to spend at least $50 million on a new facility. They don't have it. They were told the state doesn't have it. Is this the kind of thing that you might redirect federal money toward?
Well, you know, we had an announcement down in Berea with the USDA recently, $50 million that's going to FAHI, which is a community development financial institution, to administer $50 million in low-interest loans for community facilities. Now, that could go to build jails and more facilities for incarcerating, especially violent repeat offenders. And we do need to make a distinction between those who are preying on our communities and our kids, who are those violent recidivist drug traffickers, who do deserve those mandatory minimum sentences in our federal system. But for the victims of addiction, first-time offenders, we can't incarcerate our way out of this problem. So I'm very excited that some of this money could go to transitional housing. And as a member of the Housing Subcommittee, that's something that I'm really focused on, and I'm working with some groups to bring innovative solutions to transitional housing, not just helping with drug recovery, but also job skills, so that people who are in recovery can acquire the life skills, the drug skills, the financial literacy to reintegrate into the workforce.
Congressman, you have opposed the Affordable Care Act, or Obamacare, since you arrived on Capitol Hill and have voted repeatedly to repeal it. Is that the only way to deal with the concerns that people have, or could changes be made to that act, as one candidate for President, Hillary Clinton, proposes doing, whereas a candidate, Trump, wants to scrap the ACA?
Well, look, for my constituents who even support the ACA, even they tell me that the failures of this law are just piling up. I mean, just look at the evidence. Premiums and deductibles going through the roof, millions of Americans receiving cancellation notices of their health plans in the mail, rural hospitals in central and eastern Kentucky telling me that their bad debt is up, their charitable care is down. We had to block some of the cuts to Medicare. We had to block some of the cuts to what's called dish payments to these rural hospitals, because Obamacare is devastating these rural hospitals. You see the co-ops collapsing, 23 national co-ops, including Kentucky's co-op, collapsing because it was actuarially unsound. What does that mean? That means these are people who previously were insured. They had their high-quality private plans canceled. They were forced into this nonprofit co-op that now failed, so they're losing their health plan now for a second or third time. It's just ridiculous. And the American taxpayer has lost over $1 billion down the drain in taxpayer funds that they paid for these failed co-ops. So the failures are not in doubt. And so what we need to do is we need to replace Obamacare with something that works, that actually lowers the cost of health care. And, you know, more coverage is great, but it's access to a waiting line.
Well, do you start from a standpoint of that some things that are in the Affordable Care Act would remain? There were lots of things that you have said are popular.
Well, if you look at what we have proposed, and I've been part of this task force for the last 9 months, we want to be in the House Republican Conference a proposition party, not just an opposition party. Everybody knows that Andy Barr and Paul Ryan oppose the Affordable Care Act, the Unaffordable Care Act, Obamacare, but we've taken it a step further because we don't want to go back to the status quo before Obamacare. That was a broken healthcare system as well. We've proposed solutions. And if you go to a betterway.speaker.gov, our website, you can click on the healthcare, you will see a comprehensive healthcare plan that will actually lower the cost of healthcare, but restore the patient-doctor relationship instead of putting bureaucrats in charge.
Would you keep portability? Do you keep pre-existing conditions that redlined people out of coverage previously?
Well,
those sorts of
we
things?
don't keep Obamacare because that actually doesn't solve these problems very well, but we do fix the problems of pre-existing conditions, and we allow for portability in new and innovative ways. Instead of individual mandates that punish people who can't afford health insurance, or an employer mandate that's shrinking the labor market by 2.5 million workers over the next 10 years, what we do in our plan is we give individuals a refundable tax credit. We expand health savings accounts. The proposals include my legislation that would help medical liability reform, cut down on defensive medicine and the doctor shortage, and lower the cost of health care. We allow for better risk pooling. We certainly deal with the pre-existing condition problem with high-risk pools, but we also say for those small businesses that can't afford to provide health insurance for their workers, we allow them to go into association health plans and pull together and achieve the purchasing power of large employers like Toyota. Those are the best private health plans around.
As you know, Kentucky expanded the Medicaid under the Health Care Act. Thousands of Kentuckians got health insurance for the first time. Governor Bevin seeks a waiver from the federal government to make changes. Are you involved in that effort?
I am, and I signed a congressional delegation letter with my colleagues in the U.S. House and our 2 senators in support of the application for a waiver. I think it's very innovative. I think it would encourage what the Affordable Care Act was supposed to do, which is to get people into wellness programs and preventive care. And I applaud the governor and Mark Birdwhistle and those responsible for being the architects of this innovative approach. I hope that the federal government approves this waiver, because not only is it going to encourage and incentivize wellness and preventive health care for our Medicaid beneficiaries, it's going to be more fiscally sustainable for the state. And I really love some of the innovative work that they've done in terms of trying to help people into drug rehabilitation and recovery.
Congressman Andy Barr, a Republican who is a candidate for re-election on November 8th, is our guest on Kentucky Newsmakers. Back with more in just a moment. Welcome back in. Great to have you with us here on WKYT as we continue on Kentucky Newsmakers. We are visiting today with Congressman Andy Barr. He was elected in 2012 to Congress. He is now seeking a 3rd term in Washington. He's a Republican, and the Democrat is Nancy Jo Kemper, who is his opponent in this campaign, who, by the way, says that you don't spend enough time with caring about people who are needy in the district. She says that you're all for the people with money.
You know, that's really sad, because those who've actually followed my work in Congress know that I'm actually a leader in trying to reform the nation's anti-poverty programs. And we've spent a lot of time with the Lexington Housing Authority as a member of the Housing Subcommittee. I've served meals at the Salvation Army. I've worked in food banks. I've been an advocate for the TFAP program for the Kentucky Food Banks Association. And we've been to the Clark County Community Services and looked at what they're doing and the good work that they're doing. I've worked with the Federal Home Loan Banks and how they assist Habitat for Humanity. I have sponsored legislation that fixed a Dodd-Frank regulation that was going to put Habitat for Humanity out of business. So we're all about helping those wonderful and compassionate people in our communities who are on the front lines fighting poverty. But the truth of the matter is, those who are honest about the situation in this country, poverty is a bigger problem today than it was even when we came out of the Great Recession 7 years ago. We're in the 8th straight year of poverty, 40 million or more Americans struggling in poverty today. And if you're honest about looking at the war on poverty, we really haven't achieved the goals of the war on poverty. If you're born in poverty today in 2016, you're as likely to remain in poverty as you were in 1964 and 1965 when President Johnson declared a war on poverty. We've spent $22 trillion in taxpayer funds fighting the war on poverty over the last 50 years, and yet we've got more people living in poverty today. So I think we've got to be honest about the situation and recognize that these big government programs are looking at people, low-income Americans struggling in poverty, as liabilities to be managed by some distant, remote bureaucracy in Washington. I don't see people who are struggling in poverty that way. I look at people who are struggling in poverty as assets, whose lives have greater potential. And while some of these welfare programs have succeeded in helping people cope with poverty, they haven't helped people escape poverty. So I co-chaired an initiative, the Republican Study Committee Initiative, Anti-Poverty Initiative, and I was part of Speaker Ryan's task force on upward mobility to reform our anti-poverty programs, to better coordinate them, to better direct those anti-poverty programs to the people who are truly in need, the disabled, the elderly, children, instead of just paying able-bodied working-age people to not work.
Your opponent also calls for a hike in the federal minimum wage. You have previously called that a job killer. The current minimum, $7.25 an hour, went into effect in 2009. Is that where it should stay?
You know, what's interesting to me is as I travel around the 6th Congressional District and I talk to employers, I talk to plant managers and HR managers, you know what they tell me? They have dozens of jobs available, starting jobs for unskilled workers that are starting wages of $14 an hour. And they can't find people to fill those jobs. And they're talking about unskilled workers. You know, the marketplace, the labor market is well above the minimum wage. We don't need the minimum wage to get people into good paying jobs. We need economic growth, and we need to reform our welfare system so that these employers who I talk to say, look, we're competing against the government and we can't find workers.
So you oppose a hike in the minimum wage?
Well, of course I oppose adding additional costs to employers to hire more people. And I think what we need to focus on is look, minimum wage jobs are stepping stones. We don't want to make it harder for people to get into those entry-level jobs, especially these basically internships for teenagers. Most of the people who are in minimum wage jobs are teenagers. They're not adults who have been trained. What we need to do is incentivize employers to continue to create these jobs that pay much more than the minimum wage. You know, the left in this country, they're not very imaginative, in my opinion, when they look at how do we really help? How do we really help people escape poverty? Their solution is raise the minimum wage a little bit, a few more taxes on the rich, maybe a few more bureaucracies in Washington. We've tried that. We've tried that for 50 years. The better, more innovative approach is robust economic growth, reforming our welfare programs to help people achieve their potential, upward mobility, and self-sufficiency through the dignity of work. And, you know, I think that these are much better solutions.
You made a glancing reference to this. You sit on the Financial Services Committee this summer. People were stunned to find out that Wells Fargo, a major financial company in this country, had opened up more than 1 million unauthorized accounts. Does that indicate that the reforms that were passed in 2008 didn't go far enough in reeling in that kind of thing? You
know, if I was a wronged, defrauded customer of Wells Fargo, I would be furious at that bank. And we held a robust oversight hearing where the CEO came before my committee, and I held that CEO accountable, and I had him on the record commit to me that he and his team would work with me if any of my constituents were wronged by their fraudulent activities so that we could make it right for them. But if I was a wronged customer of Wells Fargo, not only would I be mad at that CEO and that toxic culture, as I called it, that rotten culture, but I would be furious at the politicians and bureaucrats who for the last 6-7 years promised me that if only they just passed this Dodd-Frank law, a 2,300-page law out of Washington, or passed 400 new 1,000-page rules and regulations, that they would protect consumers from Wall Street banks. You know what happened? What happened with Wells Fargo is that Dodd-Frank gave Wells Fargo a permanent taxpayer bailout guarantee. And it also politicized the allocation of credit with a consumer watchdog agency that was asleep at the switch, that didn't do its job. And meanwhile, the avalanche of rules and regulations and red tape came down on community banks and credit unions that are the competition for the big Wall Street banks like Wells Fargo. And so you know what Dodd-Frank did? Dodd-Frank paved the way for this kind of fraud because it took away the accountability for Wall Street banks. So I'm fighting not only to hold the regulators accountable in Washington, but also I'm holding Wall Street accountable.
Some rural areas get looser lending restrictions, and you've said that some of the counties in your district are misclassified. I know there's been one area that you're concerned they don't get that benefit.
That's right. And, you know, people talk about the effectiveness of Congress. In these polarized times, I was able to work across the aisle with Democrat Ruben Hinojosa from Texas, and we not only passed that law, it was signed, passed that bill, it was signed into law by President Obama, regulatory relief for rural community banks and credit unions in my district. That is a real success for the customers of these rural communities.
On immigration, do you support building a wall with Mexico? Would you vote to fund it?
Well, of course I do. We don't have operational control over the southern border of the United States. It's not only an immigration problem, it is a national security problem. It is what is fueling our drug epidemic. And so not only do I support building a wall, I support something better than that. I support the McCall Homeland Security bill that would, yes, build a fence, but also beef up our Customs and Border Patrol, would help get the National Guard from our border states down there and help more military aerial assets to protect our southern border of the United States. Also, I support interior enforcement as well. But here's the tragedy of this situation, this broken immigration system that we have. It's unfair to the legal immigrants in our country. We are a nation of immigrants. We should be proud of that. But we're also a nation of laws. And when we allow people to come to our country illegally, you know who it punishes the most? It punishes those wonderful legal immigrants who come to our country, and we work with them in our casework operation, the refugees who are vetted, who are safe to our country. It is unfair to punish them, to put illegal immigrants in front of them in the line. And so I support legal immigration, and I think it's wonderful when we go to these naturalization ceremonies. But when an immigrant comes to this country and goes through that citizenship process, what we want is when they declare their allegiance to the United States and they put their hand over their heart, we want them to mean it when they pledge allegiance to our flag.
All right, Congressman Andy Barr is with us. A couple more questions before we go on Kentucky Newsmakers here on WKYT. We'll be right back. Welcome back into Kentucky Newsmakers on WKYT. Our remaining moments now with Congressman Andy Barr, Republican of Kentucky's 6th Congressional District. You've given what some may consider to be mixed signals about the man at the top of your ticket, Donald Trump. You were harshly critical of the audio that came out from that 2005 video shot on a bus. Do you continue to support Donald Trump for president?
As I've said repeatedly, of course, his gutter talk is offensive, obnoxious, and indefensible. But when you look at what's at stake in this election, I'm for an agenda. And if any of the viewers out there want to know what that agenda is, they can go to abetterway.speaker.gov on health care reform, on national security, on a better way on poverty. How do we get our economy going in? Again, take a look, tax reform. Look at that agenda. That's what I'm for. And regrettably...
Do you support Trump for president?
Well, that's what I'm saying is that Secretary Clinton is going to oppose that agenda. Mr. Trump has said he was supporting that agenda. I owe it to my constituents to try to advance this agenda. And frankly, the alternative to Mr. Trump is a terribly corrupt person who is unfit to be commander-in-chief, who has exposed top secret American national security secrets to our enemies and then lied repeatedly about it. The pay to play for corruption at the State Department is terribly offensive. And revelations continue to come out. She covered up and lied about her repeated denial of additional security requests from our ambassador in Benghazi, and she's frustrated the investigation of members of Congress. We've requested these emails. We now know that 30,000 of these emails have been destroyed by Secretary Clinton or her surrogates, even though they were subject to a congressional subpoena. So regrettably, if Secretary Clinton prevails in this election, Congress is going to have to engage in some continued searching oversight.
Trump has said that he is for term limits, and under his plan, you would be beginning your last term because he says 3 terms and you're out in the House.
Well, as you may know, Bill, I introduced a constitutional amendment to impose term limits on members of Congress. 6 terms is my proposal because I want symmetry. I don't want an unfair advantage for the Senate. I want symmetry between the House and the Senate. But what I've come to discover in my 2 terms in Washington is, as much as I support congressional term limits and preventing careerism in Congress, we have a bigger problem in the executive branch. Unaccountable, unelected bureaucrats and the careerism there that is disrupting the separation of powers. So not only do I continue to support congressional term limits, I'm very vigorously focused on reining in unilateral action by the executive branch.
Quick answer on this. Do you believe that Paul Ryan will remain Speaker after the November 8th elections? I mean, does he have support within the party if the Republicans hold Congress?
I do. I credit Paul, my friend, for advocating this Proposition Party agenda, this positive agenda to fix America, to save our country.
Congressman, thanks for coming. We appreciate it. Thank you for joining us for this edition of Kentucky Newsmakers on WKYT. I'll see you bright and early this week on WKYT This Morning. Have a good week ahead.